University of Maryland Medical Center wants to charge its patients more. As Paul Gessler reports, this comes amid reform within the medical systems board.
Just in the past 2 months, news of self-dealing and no-bid contracts have contributed to the resignations of Baltimore Mayor Catherine Pugh and medical system CEO Robert Krenzik. And now the medical center is asking for a rate increase.
The Healthy Holly children's books are the most high profile of the self-dealings the University of Maryland Medical System's Board of Directors made with its members. The purchases spurred legislative reform, requiring multiple audits and the entire Board of Directors to resign. Earlier this year, the medical center requested a nearly 5% rate hike to increase its billing by $75 million a year.
They should hold off until some of the investigations are done or the internal and external audits are done. The legislation called for that.
State Senator Jill Carter's bill brought light to the procurement problems and says the timing for the rate increase request could not be worse.
Right now, of course, there's going to be this perception that this rate increase, this massive rate increase, somehow is a result of the self-dealing.
Last month, the medical system's interim CEO, John Ashworth, acknowledged mistakes, but he said he did not believe anything criminal happened.
Yes, there may have been some missteps. Yes, we will need to tighten up those missteps, but I am confident that our board will take action accordingly.
A spokesperson for the medical system says the rate increase will help the hospital meet patient needs and serve as a safety net for the community. Senator Carter acknowledges the medical system's needs, but says transparency is key.
We need to make sure that they have the adequate resources for that, but we also need to make sure that they're spending wisely and fairly.
Ultimately, the decision on the rate hike will be up to the State Health Services Cost Review Commission. Reporting downtown, Paul Gessler for WJZ.